Holiday festivities, they're in full swing and no one wants to be sick or spread germs instead of that holiday cheer. But injuries and illnesses and sicknesses happen even during holiday celebrations. So with us today is physician assistant Cody Martin with Cone Health Virtual Care, and he's got all kinds of ideas for staying healthy and then what to do if someone in your house gets sick this week. So let's start with the prevention, because we all love a little bit of prevention. What are some of the top recommendations to help stay healthy and avoid catching the common things that go around when we're all going to be together this week?
Sure. So, as always, the best way to prevent the spread of infection is hand washing, right? Good hand hygiene. We recommend, washing your hands thoroughly and washing them often, especially with these holidays, being in large groups, being, sharing a lot of, having a lot of shared surfaces where germs like to hang out. Very important, right? And we always recommend, when able, to actually wash your hands, right? Clean water, a good bit of soap, making sure that you are lathering up for at least 20 seconds before rinsing, and not just getting, the palms of your hands, right? We want to make sure that you're getting the backs of your hands between the fingers, scrubbing your nails, kind of using your palm as a scrub board. So at least 20 seconds, and then rinsing thoroughly and patting dry. Um, for those times when you don't have a sink or some soap readily available, keeping a bottle of alcohol-based hand sanitizer handy so that you can kind of do the same thing, right? Apply a little dime size amount, rub it in really good for 20 seconds and let it air dry. That can be very beneficial in helping to prevent the spread of illness. Of course, if you are starting to feel under the weather, stay home, right? If you happen to be around someone that you know is sick, trying to isolate yourself from them a little bit, keep some distance. Masks are very important and can be very beneficial, especially with, last minute holiday shopping where you have to go out in the crowd. That can really help prevent the spread of infection. Um, also,
I love your show and tell of the hand washing, because most people, they stick their hands in there, they do this, and then they're done. So seeing that the palms and underneath the fingernails, those are really good points.
Absolutely. Yeah, it's a marathon, not a sprint. So take your time. Um, Another thing is just avoiding as best you can, trying to avoid touching your eyes, your nose, your mouth. Those are really, big portals for infection. Um, and then, of course, talking to your healthcare provider about any seasonal or routine vaccines that may be beneficial to lower your risk of contracting an illness.
All right, let's talk about some common injuries this time of year and how they can be prevented.
Sure. So one big thing, especially in adults, can be like back strain or back injuries, putting up the Christmas tree, carrying heavy presents, things like that. So it's really just, try not to be Superman or Superwoman. Be mindful of what you're lifting. If you need help, ask for help. Don't overexert yourself. Um, Other things you would think about, especially with small children, would be, maybe increased choking hazards, not necessarily just from all the Christmas goodies, but new toys. If they have small pieces, children, it only takes a second for them to pop it in their mouth, right? So just being mindful of, the age on the toys you're buying them, the age recommendations, right? Don't give anything too small to a small child.
All right, so let's say you start feeling achy the week of Christmas, you have a sore throat, your stuffy head. I mean, this is like the last week that you want to go to the doctor, but what should you be doing?
Sure. So the first thing, really, again, if you're starting to feel under the weather, try to stay home, right? Um, if you can get in with your primary care, go ahead and give them a call, let them know ahead of time of what's going on. And certainly, you could also do like a virtual care visit, which I believe we'll talk about. But um, really home treatment. So if you have a bit of nasal congestion, it's certainly safe to start like a saline nasal rinse or using a neti pot at home just to flush out the nasal passages. Being aware, if you use something like a neti pot, you want to use distilled water, no tap water for that. And then, your typical over-the-counter like pain relievers like Tylenol or ibuprofen. Um, just knowing which ones of those are safe for you to take with your medical history, right? Those are good things to start because they can take care of, your mild headaches, sore throat, body aches, things like that. And then, really, if you're just feeling under the weather, we want you to reach out. That way, you can talk to a healthcare provider who can tell you next steps, tell you what would be or wouldn't be appropriate as far as being around other people, and just getting you, feeling better as quickly as possible in general.
Okay, we've given you all the recommendations for what you need to do if you stay at home. But what if you really do need to see the doctor, that kind of thing? We're going to be talking about those options, what's open the week of the holiday when we come back.